Fauci himself is went on TV and started lecturing us about wearing a mask, even if other people aren't.
Because you go into a situation where many people are not wearing masks is not a reason for you not to wear a mask.
Okay, can't you just picture Fauci in an airport or in a big party? He's the only one wearing a mask. Everyone else is common sense. Everyone else knows that they're baloney, and Fauci's just walking happily along wearing a mask. No thanks, no thanks. So the White House coronavirus response coordinator, his name is Dr. Ashish Jha. He says that not only should you choose as an individual to wear a mask, he's actually advocating for mask mandates at the local and state government level.
No, I have to say, I've been traveling again this week on airplanes, in airports. So few people wearing masks. And in New York City, where they have a 15% positivity rate, the New York Times described it as kind of a meh reaction to this variant. So what do you do?
Yeah, so first of all, I think it's really important to remind people of the science, the public health science. And the public health science is very clear. If you're in a crowded indoor space, that's especially if it's poorly ventilated, wearing a mask reduces your risk of infection and reduces your risk of spreading it to others. So we've got to continue to encourage people to do that. We've been doing a lot to make testing widely available. It's a really good way of slowing down the spread. And then encouraging people to get, vaccinated and get up to date on their vaccines. And then obviously, as I said earlier, if you end up having a breakthrough infection, getting treated, because we don't want people ending up in the hospital. And treatments are working really well.
And LA County announced this week that if cases continue on the same trajectory, they will have an indoor mask mandate. It looks likely that will happen. I assume that's something you support. Should other states look at this?
Yeah, my view on this has been for 2 years. Well, before I came into this current role, my view on this has been very clear, which is local jurisdictions, cities, counties, states should make decisions about mask mandates because communities are different and their patterns of transmission are different. That said, CDC has very clear guidance on this as well through their COVID community levels. And the CDC recommendation is that when you're in a high zone, that sort of orange zone, as LA County is, people wearing masks indoors is really important, and it really will make a difference.
Okay, so the comment that he made that stuck out to me the most is when he said, the position that I have held for the past 2 years, even before he was part of the Biden administration, is that these decisions, these mask mandates, should be implemented by local governments. And at first glance, this seems like, okay, that's what we as conservatives stand for. We want local governments to make decisions, as many as they can. And if the local government can't make it, then you go to the state government. If it can't be handled at the state level, then you go to the federal government. But as local as possible is best. It's a federalist attitude, but even more than just at the state level, at the local level. But we're going to get to this in just a second when we start analyzing Dr. Birx's book. This is a strategy and a tactic that the left has been utilizing during the entire last 2 years related to COVID, where the executive branch of the federal government, first it was the bureaucrats in the Trump administration, and then it was the Biden administration and bureaucrats like Dr. Ashish Jha. They write the guidance. They essentially tell local governments what's expected from them. But then when local governments issue these mandates and the people are unhappy about it, the federal government can say, oh, no, our hands are clean. This is something that's handled at the local level. This is not something that we did. This was your state representatives. This was your governor. This was your mayor that believes that this is best for your locality. But the directions or the directives to these local government officials is coming from the Biden administration. They're getting pressure from the federal government. And like I said, we'll get into more of that in a minute because Dr. Birx talks about that in her book. But what Dr. Ashish Jha is saying is actually anti-science. He says that masks in general really will make a difference. And we know studies show that is not true. Studies show the efficacy for surgical masks versus cloth masks versus N95s or KN95s are very different. He doesn't differentiate that at all. He also talks about testing. What difference does testing make if you're not symptomatic? It doesn't make a difference at this point. It's just a way of identifying more cases so they can perpetuate this narrative. But you'll notice that the two things that he's calling for as a solution to this are vaccines and these other pharmaceuticals that he wants people to take, not ivermectin, not hydroxychloroquine, these other pharmaceuticals that profit big pharma. So his two solutions, or his three solutions, are give the government more power, get your vaccine, which profits big pharma and Fauci, and take these other pharmaceuticals, which have questionable efficacy, but also profit big pharma.